This is an MRI cross-section of the abdomen of a 60-year-old Japanese man. And on these images, we can see the subcutaneous fat, which is the fat that's between the skin and the muscle. And then we can also see the visceral fat, or the fat that's between the organs. Today I want to talk about this study. MRI-derived abdominal adipose tissue is associated with multisite and widespread chronic pain. Here's the TLDR. It's been known for a few decades that higher levels of body fat are associated with increased likelihood of experiencing chronic pain. But how the distribution of the adipose tissue matters wasn't really known. This study showed that abdominal distribution of adipose tissue has a greater effect on chronic pain, regardless of whether it's visceral or subcutaneous. And if that's all you wanted to know, thanks for watching. Hit the like on your way out, and I'll see you next time. Otherwise, let's go a little deeper. This study was published in 2019, and it included 600 adults in South Korea. They used CT scans to measure the amount of subcutaneous adipose tissue throughout their body and the amount of visceral adipose tissue in their belly. They also looked at inflammatory markers, so C-reactive protein and white blood cell count. And what they found was that patients with increasing levels of visceral adipose tissue, so those fat deposits that are between the organs in the abdomen, those patients tended to have higher levels of inflammatory markers in their blood. And you can see here, as visceral adipose tissue increases, so do white blood cell counts. And over here, you can see the same thing with C-reactive protein. However, when they looked at subcutaneous fat throughout the body, they found the opposite association. So from this, researchers concluded that it's the visceral fat accumulation that's a much greater danger in the long term. This study from 2018 looked at the association between body fat and chronic pain. And what they found is that knee pain and lower back pain are both associated with being heavier. However, the direction of causation wasn't really certain. Is it because folks are in pain, so they're not moving around as much, so they're more prone to weight gain? Or is the weight gain putting more pressure on the lower back, and that's leading to chronic pain? And their study just wasn't able to determine that. However, what they were able to find was that increased body fat was more likely to lead to increased levels of pain, which indicates that there could be a vicious cycle there where being in pain causes depression, leads you to be less active, and that leads to weight gain, which then leads to more pain. So the association between higher body fat percentages, inflammation, and chronic pain is fairly well established. This study put together a line of causation. So basically, this researcher wrote that insulin stimulates the adipose cells in the abdomen to take up sugar and then convert it to fat for storage. In the process, that fat cell grows. When it reaches sufficient size, it sends out messenger chemicals, and those messenger chemicals go over to fat stem cells. Those stem cells divide and produce new adipose cells. And then those adipocytes themselves begin to enlarge. Well, obviously, behind the abdominal wall, there's limited space. There's also organs that fill in that space. So those adipocytes start to be pressed up against each other. There's also a limited ability within the body to build new blood vessels to go between them to keep them oxygenated. That inadequate oxygenation leads to hypoxia. That hypoxia leads to increased levels of inflammation, stress on the endoplasmic reticulum, which is kind of a reaction membrane for cells, and insulin resistance. This leads some of those adipocytes to become senescent, basically cells that can't function anymore. It also leads to cell death. And when those adipocytes die, the immune cells have to try to clean up all that's left of them. In the process, the immune cells can become inundated with fat pockets themselves, and then they're no longer able to function. So then you have an increase in the number of senescent immune cells in the area, and that leads to even more inflammation. And once there's enough of that going on in that localized area, those inflammatory chemicals, those inflammatory messengers, start to leak out through the rest of the body. Which now leads us to this study. They basically looked at 32,409 participants. About half were women and half were men, and they had an average age of 55 years. And while the BMI isn't a perfect number for figuring out obesity or overweight, it is a good shorthand since most people aren't significantly muscular. The average BMI of the participants was 26, but they only looked at folks who had BMIs over 25. The participants were scanned in an MRI, basically to model how much visceral and subcutaneous fat they held in their abdomens. So they didn't look at how much was in the arms, the legs, anything like that. Abdomen only. The second thing they did was they asked them, do you experience chronic pain, and how much of it and where? The lighter color here, the lightest color, is no chronic pain. And then 1 site, 2 sites, 3 sites, 4 sites, and then all over their body. On the y-axis here is how many liters of visceral fat, so that inner organ fat, were these folks carrying. And they found that on average, the more visceral fat someone was carrying, the more likely they were to experience chronic pain throughout their body. And it was much more pronounced with men than it was with women. Next, they looked at the subcutaneous abdominal fat, so how much fat is stored between the skin and the abdominal wall. And they found kind of the same association where increasing amounts of fat that were being carried in the abdomen led to a greater likelihood of having chronic pain. But the gender association was switched. So males were less likely to have that strong association, while women were much more likely to have it. So this study kind of turns the idea that visceral fat is the bigger problem on its head. Instead, it shows that it's abdominal fat in general that causes problems. And depending on whether you're male or female, the place of deposition makes a bigger difference. When a person develops chronic pain, that actually becomes an enormous problem. This study discusses the link between depression and chronic pain. And here's one thing the authors had to say. Clinical studies have revealed that chronic pain as a stress state often induces depression, and that up to 85% of patients with chronic pain are affected by severe depression. Furthermore, patients suffering from chronic pain-induced depression exhibit a poorer prognosis than those with chronic pain only. There's also an association with inflammation in general and depression. And one thing the author notes is that drugs that are designed to induce an inflammatory response, an immune response, often lead to cycles of depression for the patient. Specifically, he discusses those who get interferon for treatment of hepatitis C. Interferon therapy works by strengthening the immune response and causes sickness behavior in almost all patients. Close to half may go on to develop full major depressive episodes, including symptoms such as worthlessness and suicidal ideation. I've become convinced that when we talk about a health problem like central obesity, that thinking about it as a personal problem or a problem where somebody just doesn't have enough control, I don't think that's a reasonable way to think about it. We need to think of it as a whole body inflammation response that can very easily build on itself. We also are living in societies and an environment where whole healthy foods are harder and harder to acquire and much more expensive. It's also becoming more and more difficult for people to live active lives and to socialize with others. A lot of people are suffering with chronic pain and depression, and I think we need to have compassion for that.